We encourage all our patients who are complaining of poor balance, learn something new, even if it's useless. Go to the third age, what is it, University of Third Age or whatever. Just learn something useless like archaeology, pottery, anything to stimulate your brain. That's all you're doing. Talk to people, okay? Challenge, even if the person is a pain in the neck, it's irritating you, it's stimulating your brain. And that's what you need. You need to get out into society. You cannot sit at home in four walls. The other big thing, please remember, you've all been major professionals in your own time, okay? A secretary has to answer phone, talk to people, constantly asking silly things. She has to file. She needs to know where that file is. She's talking to her boss. She's writing letters. Even if you are a secretary, look at the number of things you were doing. Then you went home. You looked after your home. You then also looked after children. You anticipated what food have I got in the fridge? What do I need? What do I have to buy? Look at the number of things you had to do. You retire, you come down to four walls and two people. Okay? There's no challenge. And that's what aging is. In aging, that's what they're trying to say. Please, please stimulate your mind. Do something more. Because it's because you forget how much you did when you were young. The effective pathway, this is my field. So all physiotherapists can help you with all three, the sensory pathway, the central, and the effective. We can help you with all of that. The physical response of the body during gait, that's walking, is governed by muscles and joints, okay? It's obvious. Your muscles and joints dictate how you're going to walk. If you have increased stiffness in any of your joints of your trunk, okay, up to here, and your legs, doesn't have to be arm, up to from here to the legs, and you have reduced muscle capacity, meaning your strength is less and your endurance is less. Now, because of those two, you can't stride out like you used to do before. You can't take bigger steps. You then start to walk sideways. And everyone with caliper, if you don't have the right muscles, as you weaken, you start to do more and more sideways. And as you start rocking sideways, you then start to go outside your base of support. Okay? You're now very high risk of falls just there. Increased stiffness, the more stiff you are here, the less able you are to walk smoothly. Because to walk smoothly, we need to rotate our spine. We need to be able to swing our arms. Your arms are stuck on a frame, so you have to stiffen your spine. Can you see how you're adding to joint stiffness? Now, using aids is one of my soapboxes also. Walking well with an aid is very important, but equally, you must understand the very stiffness that makes you safe will also lead to further falls. Yeah? So you've got to do something about maintaining the mobility of your spine by exercising. Poor coordination, for example, if you're just a stiffness in the shoulder, you're a little bit too slow to put your hand out. That is why you hit your head. That's why your arm didn't save you. We have to look at the gentleman in the corner. I'm so sorry. It's too obvious. It must have been so painful and so frightening when that happened. But that's why. The whole system went out of coordination. It wasn't fast enough, so you hit your head. Please remember, every time you hit your head, either here or backwards, you can be causing slow, ongoing brain damage also. You may not see it now, but over time it adds up. So there's no such thing as I know how to fall. Now, understanding it a bit more, okay? All of you are what I call low tone. Many of you, like all those, you can do more, probably if you're supported enough, you could do all of those yoga positions. You can put your nose to your knee, you can get your leg up, right up behind. It's amazing. Okay? I couldn't do it. From 30 onwards, the normal population starts to lose it. But you can, because joint mobility, you are hypermobile. You can move more than normal. Therefore, you are unstable. And over time, this instability will cause contractures in your knee, in your hip, because that's the position you adapt to be stable causes problems. And you are at high risk of injury. What happens to your muscles and tendon? They stretch and stretch and stretch. So not only are your joints stretchable, your muscles and tendons also stretch beyond normal. It's just because of the nature of the polio. It's a low tone condition. Not only that, at rest, your muscles don't rest in a nice relaxed position, they rest too relaxed. So for you to do any movement quickly, safely, you really have to increase the tone in your muscle. So at rest, your muscles don't, in a car, they're idling in a car, that is normal tone. You don't have idling in any of your muscles, especially those affected by polio. You have the engine switched off. So you have to bring it to idling, then to engage it. So that's what the low tone, the polio has done to your muscles. And not only that, because it's so relaxed, every contraction you have is weak. Not only weak, it takes longer. So that's normal. Up to now, this is what you are faced with as normal. Now, what type of muscle contraction do you have? The low tone states, as in polio, has poor static contraction. That means you can't stand still, and you know that. That is why you can keep moving, but standing still is very hard for many of you, because if you stand still, especially if you say you're balanced, especially if you are leaning against something, okay, as soon as you lean, you switch off the muscle. That is why in relaxation we support you. Because as soon as you tell the brain, hey, this joint is supported, the brain switches it off. Okay? So that is for protection. You have rapid and unstable phasing. So you're better at, for example, throwing the ball in terms of bowling. But it's very unstable. You probably follow the ball, okay? Because of that. You can throw it, but then you're not fast enough to react, so you'll end up flat on your face. So in polio, I'm saying an odd thing, your strength is greater than your endurance, meaning you can do momentary strength, but your ability to sustain, keep on going, is markedly reduced. And that is what you all translate as, I know, I'm tired or fatigued, my muscles fatigue. You just don't have the muscles to keep on going. Now, what can we do about all of that? Science, the very science that tells you by now you shouldn't be walking, also tells you you can turn it around. Okay, you can. High intensity resistance training, that is training with either lifting something or using those elastic bands, that's called resistance training. Training your type 2 muscles, your strength muscles, above 60%. Okay, it has to be above 60%. So therefore, it can't be just, oh, well, I've done 500 grams and I'm fine. Okay, if you have the capacity to lift 1 kilo, you have to work at 60% of that. And this has turned around people who are in nursing home, and it not only made a change in their strength, it made a change in their functional status, meaning these nursing home patients who underwent exercise at 60%, they could get out of the chair a bit better, they could help transfer a bit better, and not necessarily meaning they all walked, it's just that they did something better. Only just 60% of what would be a normal exercise program was enough. But more than that, it can also, the right type of exercise can attenuate, that is turn around all the age-related decline in fourth generation of muscles and can lead to muscle hypertrophy. That means your muscles can generate more strength and your muscles can grow with the right intensity of exercise. Therefore, equally said, the wrong intensity of exercise will make you lose muscle. Okay? But it's the same reverse side of the same coin. Okay? So resistant exercise training also improves the protein. Remember we said you need protein to develop muscle? So the right intensity can allow your body to process the protein better. So your muscle increases. Your muscle increases, we can make you stronger. Those of you with very small muscles who are not eating, and you've got very, very decayed muscles, you really have to, before any physio gives you an exercise program, they have to say, go and eat, look at your diet. I'll send you to a dietitian. Okay? You must have enough protein to actually build. So it improves protein. So the right exercise, right intensity and the right type. It improves torque, meaning all our muscles in our body actually have a torque force. It has a rotation force. There's no muscle in our body that works in a straight line. So when you weaken, what you do is you co-contract. Every muscle in your body has a muscle on one side of every joint. The finger has a set of muscles opposing each other. So every moving joint has a set of muscles that opposes it, in front and back. So what you do when you weaken, you make them stiff. So your neck gets stiff. Everything gets stiff. Everything starts to stiffen, yeah? The stiffer you are, the less rotation you have, the harder it is for you to walk, and you fall harder. The stiffer you are, the harder you're going to fall. And that's not a philosophical statement, okay? Please, it's a true body statement. Now, the right exercise also increases your oxidative. Remember I told about energy in the body, the mitochondria, the energy, 31%. Your body, by the right type of exercise, your body is able to utilize oxygen by increase of 31%, and your energy increases by 31. It changes the structure of the cell in your muscle. Okay, so please do not dismiss exercises. The right type of exercises is very important. I'm very busy. I do a lot in my day. Is not exercise. I'm sorry. That's not exercise. Because our research has said you need that combination. You may not, if you're walking a lot all day, you may not need the endurance exercise, but you must have strength. Okay? If you're standing in one spot doing lifting only, then you need more endurance rather than strength. Okay? But you still need an assessment of which muscles need to be stronger in which capacity. So you cannot escape, unfortunately, this assessment. Every one of you requires an assessment. There is increase in muscle size, strength, contractile velocity. I'm just putting all of those up because all of what I've said here, if you put it all together, what it says is the right exercise makes your cells absorb calcium exchange better. It makes it process protein better. It allows muscles to build. The fast and the slow twitch muscles are now building. Bigger, they're bigger. The bigger they are, the more you can work them to increase your energy. So now I have an input into making you, improving you, turning it around. If you come to me too late with wear and tear, all I can promise you is I'm holding you. I can only hold you where you are now so that you can do what you're doing now for the next 5 to 10 years. But if you come to me early enough, for those of you who say, look, nothing wrong with me. I had polio, but there's nothing wrong with me. I feel bad because there are people worse than me. I say to my patients, please come so that I have a baseline on you. So that when you come back to me 1 year, I have a comparison. If I don't have a comparison, I'm not going to know what your muscle could do a year ago as to what you can do now. I don't have that. So I need an assessment. It's not wasted. At least I can give the patient, I talk my patients through, are you doing this exercise? Are you doing it this way? What are you doing? I can talk them through activities and exercise to make sure they maintain so that they don't have to come back to me. Okay? So that is my aim for the able-bodied polio. For those with disability, with muscle weakness and paralysis, you need a bit more TLC. Okay? That's tender loving care. I can't ignore you. So, but in terms of outcome, even low-intensity resistance exercises, something simple as an elastic band tied to a pole in your home, okay? Even that will help you, but you need to know how to move it. Because that person can actually fall if she doesn't have the muscles in her foot to stabilize her. So that's all it takes. Poor muscles in your foot and you're falling. You're doing the right thing because physio said, but you're doing it in the wrong position. So, but even a small amount has shown to improve muscle strength and has an impact on increasing your muscle size. So what have I told you today? Very boring, very heavy subject, this one. I've gone through normal aging at a cell level and at an organ level. I've touched on the cell processes, pathophysiology, and the clinical presentations, yeah? Why you have what you're experiencing. I've given you a really large overview of exercise, that you really need to do exercise at a certain intensity to have an outcome, yeah? For example, another number I always quote to my colleagues is, a polio patient with a paralysis has to work, and not at 60%, at 50% of mass, of your one max. So you need to understand how to set the one max. That's a bit more technical there. So 50%. If you don't have paralysis, you can work in that 60, 70%. Okay? That's the intensity. So that needs a bit of understanding. So let's look at a summary. So again, to recap, when does the downhill slide start? It starts when you are telling me, for you, it started long ago, but it started for you only when you couldn't do a functional limitation. It started because of deconditioning, because you just started to draw from your bank balance and you never did anything to put it back in. From that, it went to decreased aerobic capacity. Your muscles, because of deconditioning, your muscles couldn't use your oxygen well. Because they couldn't use oxygen efficiently, you decrease the movement. Your arm doesn't go as high. Your legs don't go as high. You don't stride out as well as you could. So there's decreased mobility all around. Because of that, you have increased tiredness slowly, because you're doing less and less, yeah? Or you're doing more just to cover the same distance. So you're burning up more energy. So instead of walking in 10 steps across the room, you're now taking 20 steps. So it's harder for you. So you get increased fatigue. Once you start feeling tired, you're now going to be tired with any activity in the home, functional mobility tasks. And you've got to force yourself. Yes, you're doing it. I can't do it. I have to do it. I have no one to do this. I have to, yes. But you can make it so much better. You don't have to struggle. Once you're doing less around the home, you really are in the danger period. You're decreasing your pain threshold. So if you have able-bodied people who are aging, tell them it happens to them too. Okay? You're just having it faster than them. You have decreased pain threshold, so everything starts to hurt. Once that happens, you have loss of sleep. Once you start losing sleep, you have lost quality of life, and now it's a ever vicious cycle. This vicious cycle is now self-sustaining. Okay? Now, how you stop the slide and take control? How do you take control? First starts with self-care. Okay? You have to address the self-care component. What you do in the home has to be addressed. You have to increase the aerobic fitness first. So I have to feel that I have enough energy and enough oxygen in my muscles to start working. Now, in terms of intervention, this is where the intervention starts, the endurance. Okay. Now the physio has to, I talk to my patient and say, right, I need to increase your endurance. This is how we do it. Once I increase your endurance, once you have more energy in your muscles, every activity takes less energy. So there's a decrease in energy expenditure for the activities around the house. Okay? Once you have a decrease in energy, you feel you're more physically active. I'm less tired, so I can do more. That's what we're aiming for. Once you feel you can do more, you therefore now increase your functional mobility. Okay? You're more mobile, you can get out of bed easier, you take less time to get out of bed, walking toilet, cooking, everything becomes a little bit easier. Not to say you don't pace, the pacing is also there. Once you're functionally mobile in the home, you're self-care. You're independent now in self-care. Once you know this, and all of you know it so well, once you're able to look after yourself, there's well-being. That concept of well-being is very important. How well do you feel? Because we as Allied Health can always assess something called quality of life. There are questionnaires we send out. And we don't talk about muscle and joints. We talk about how well-being, quality of life questionnaire, well-being. Okay, that's the well-being. If you feel that you have some control about at least within your home life, you've got increased well-being. Now, you have closed the cycle. You're increasing your aerobic fitness. Okay, because you feel well, you can do more within the home. In other words, what I'm saying is, if you're active in your home, that within the home, independence will be there. Okay, you're not going to lose it. You'll only lose it if you fall and fracture or you have a disease process. The polio will not stop you as long as you have that well-being cycle. Now, how do we intervene? So this is where the physio comes in. Now, to improve the wellness cycle, this needs something outside the home. Okay? Now, to step outside the door of your home is what's wellness. Wellness is from endurance. The physio has to set an endurance program, and then she needs to work on your strength. Without endurance, I cannot improve your strength. So if you've had a heart attack, for example, any of you had an ischemic heart attack, you know how it just washed out, okay? And then you have to go, the doctor said you're fine, but you're so washed out, you just don't have the energy to get up and do the activity. And every time you force yourself to be active in the house, you're getting more and more tired. And I've had patients who've had heart attack, massive cabbage, they recircuit your heart, your heart and lung. Those things, patients will come with paralysis. Now, where do I start? We just start by saying, please sit out in a chair for more than 1 hour. Sit out in the chair for 2 hours. That's tiring. We get the family, take them around the hospital. So that is what I mean by improving the endurance. It's as slow as that sometimes, yeah? Right. Then once I have endurance, I can improve strength. Once I have strength, now the physio can work on your power, get you moving faster. Once I have that, I have improved your balance. Okay? Now I can actually work on your balance to improve it. In other words, without power, without strength, without endurance, you have loss of balance. Okay? So to improve your balance, I must have endurance, strength, and power. Now I can make an impact on which aspect of balance you are suffering. That's assessment. Once you have balance is when you have independent ADL, meaning activities of daily living, which is what you do outside your home, shopping, driving, gardening, etc. That's in activities of daily living. Only then will you improve it. So if you don't have balance, if you don't have power, if you don't have strength, if you don't have endurance, you're not going to be independent outside your home. Once you are independent outside your home, now, only now can you exercise for health. This is the gym. This is going for the exercise groups in the community. And that's what the doctor tells you to do to decrease your signs of the metabolic syndrome, which is your diabetes, high blood pressure, high cholesterol, high fat. That's called metabolic syndrome. And we know, for those of you who are borderline, we can actually turn it around so you don't need medications. Those of you who have chronic diabetes, chronic high lipid, chronic high blood pressure, by the right exercise, we can reduce the amount of drugs you're taking. Because if your high blood pressure keeps going up, what does the doctor do? He's got to just add medications to you. And you know medications have side effects, and you know many of you know that already. Now, once you are able to exercise for health, and you start making an impact on all of those metabolic signs, your health, your general health improves. Okay? And once your general health improves, your aerobic fitness is self-sustaining. Okay? So now you are in a cycle. This is the exercise cycle. The yellow bit is the exercise cycle. And once you get at least a baseline exercise circuit going, your basic health is now on the upward climb. Okay? And you have to reach that for the next cycle, which is a lifestyle. Not all of us will go to a gym and do exercise day in and day out. It's very boring. But you must do enough exercise 3 times a week for 3 months to turn around your strength. Daily for 3 months to turn around your endurance. That is a formula. It doesn't change. Every research article will always quote this 3 months and 3 times a week. If you do it twice a week, it'll take 6 months. It's almost as prescriptive as that. The wrong intensity of exercise will turn you around in one day. Overnight, you'll feel worse. Okay? The right type will build you up, but you will see a change only at 2 months. You will see a change, definitely. And that's what I tell my patients. In 2 months, if you're not seeing a change, call me. Either I have given you the wrong exercise or you're doing it badly. I've got to have a fallback position. Huh? You know that. Your doctor always says, you must have done something wrong, Mrs. Jones. Chiefs always do that. So, lifestyle. That is why you need now, from the yellow circle, you need to go into the green circle. You need a lifestyle activity so that from well-being, you know, if you feel well, you know you'll entertain your family and you'll go out with your family because you feel well. Once you do family participation, now you have social participation. That's what you've got to target. If you can get into that social participation cycle, you are now, your lifestyle will sustain all of this. Okay? So the lifestyle meaning something like golfing, but not once a week, twice a week. Bowling, twice a week. If you go swimming, the right type of swimming, twice a week. You must do something twice a week. You don't have to go and lift weights, but you have to do an activity twice a week. Now, for the very elderly who are independent in the home, many of you are in that age group, your housework is exercise enough, okay? But don't do, I can only do my housework in one day. I refuse to do it in sections. Please abandon that, because what you're doing is you're wearing, your exercise, your home cleaning is wearing you down, okay? So, 2 rooms one day, 2 rooms, have a rest if you have to. And next day, 2 rooms, whatever. You're washing, divide your washing into 3 times a week. I know you're going to use more water, but it's an exercise. Because, you know why? Not only taking it out and hanging up, it's all exercise for your hand. You don't need a gymnasium for that. Many of the farmers who come to us, in fact, we tell them, get onto one of those motorbikes. Don't try walking on your farm that is up and down. And in all I've seen in New Zealand is farms that are 60-degree incline. I don't know how, your farmers are so super fit, amazing. So, but we are fairly flat in Western Australia, but there are farms that are uneven. I said, go onto those motorbikes. Because what you have to do is be able to walk in the home to look after yourself. So that's enough exercise, yeah? So what you do at home, for the more elderly, you don't have to go to gym. What you do at home, your gardening, what you do is fine. But it's how you do it. Use aids, okay? If you're walking with caliper sideways, I'll just give a small example. If you are walking with caliper, there's a tendency for sideways. It's very hard to walk forward, just by the nature of a caliper, the way the calipers are structured, especially if they are not quite. Two things. I won't blame the orthodontist here. Two things. You need this muscle, super strong, to carry a caliper. You forget that, okay? Anyone with a brace on the leg, it's actually the strength is coming from your hip and your trunk, both your front and your back. If that weakens, you're now going to hike, what we call hiking. You're tipping yourself, so you're using gravity really. Okay, so now you're sideways walking, and then you carry a weight here. Your center of gravity is shifting forward. You're always just on the brink of falling. Why? Put it on a trolley. It doesn't do anymore. So those are sensible things you need to do. So if you're, as I said, if you're homebound, you're looking after your house, your garden, I do believe that's exercise enough. Now, that assessment must be made by a physiotherapist, depending on the muscles you have. I would certainly say people in the 85s and over, if you're looking after your own home, but be sensible. Don't go back and look after your own home just because I said it. I also say the worst thing for your back is a vacuum cleaning. Give that to somebody else. You're cleaning the wet areas in your bathroom is such a dangerous place. Get somebody to do it. Or sit down and do it. If you're sitting down doing it, you're fine. You can't fall. The one slide, you're gone. You really are gone. So adapt if you have to. If you want to keep cleaning your own home, adapt. Do whatever you can. But talk to a physio. Talk to an OT. Now, I was talking to Dr. Liz and Annie. Each of you requires 8 allied health. A GP, advice from an OT, a physio. You may need social worker for funding. You may need a speech therapist if you've got swallow, digestion. You will need an orthotist if you have bracing problems. You need a dietitian if your diet is poor. And you need a pharmacist if you're taking medications that affect you. 8 people, just advice. Can you see this? So that is why you all are very expensive people, and the health department says there's not enough of you to warrant a clinic, which is why I'm selling the idea of a late effects clinic. You know why? Behind you come all the others. Every amputee, every stroke patient 10 years down is going to need what you're doing. So we set up clinics. I've asked my colleagues, please do something. Please do something, and let's share ideas. Because in the medical field, this is new, this concept of late effects. They understand aging, but they are forgetting to apply that concept to aging with a disability. Okay? So independence, fitness, and lifestyle is your choice. Okay? What you do and how you do it, it's your choice.